on participatory research and patient and public involvement. These are all terms that if you're not familiar with right now, then you will be in, I don't know, the next hour or so. First off, we've got Eleanor Laws coming to speak to us about the participatory research work that she's been doing, both in her role at University Hospitals Birmingham, and also at Data Science for Health Equity. And following Eleanor's talk, we then have a panel discussion with a colleague of mine at the Health Foundation and a couple of experts by experience who've been involved in some really interesting data science work over the last couple of years. So, welcome.
Thanks, everyone. So I'm Eleanor. I'm a doctor, but I've been working in full-time research for a couple of years now, mainly on this project that I'm going to be talking about called Standing Together. But I thought I'd just give a little bit of a background about what I perceive PPIE to be, patient and public involvement to be, and then using our project as a bit of an example of how you could go about integrating it into your work in the future. So what is participatory research? Well, it's a concept that you, as part of your research, shift the power from the researchers over to people with lived experience, with the idea that actually you're co-producing the work rather than producing work about people. It's a real process of reflection, but also acting on that reflection to try and make sure that the work that we produce is grounded with the needs of the people that it's intended for. So the idea is that it's research carried out with and about local people rather than about them. And it's a collaboration between people with diverse experience, whether that's professional background or lived experience and demographic background. And just a bit of a heads up, it can be a bit confusing talking about this sort of work because there's a lot of different synonyms to describe it. It varies across the world, but in the UK, most of the time, people use participatory research or PPIE, patient and public involvement and engagement. And it's becoming an increasing requirement from funders. So this isn't just something that should be done as a tick box exercise, that's for sure, but it's becoming much more common that as part of grant applications, it's becoming a requirement. And so it's definitely worth thinking about from the offset of starting out in a research project. But the talk that I'm going to do today is actually about a project that I've been working on for a couple of years that's part funded by the Health Foundation, and that's the Standing Together project. And we integrated a variety of different PPIE activities within this project in some different ways, which I hope you'll be able to use as an example to guide your future practice too. But just a little bit about this project. It's a project that is relating to artificial intelligence in healthcare, and it's based on this idea that whilst there's a lot of hype around AI in healthcare, which I'm sure you're all aware of, given that it's basically in the news every day, there is actually a lot of potential for harm, and I'm sure you as analysts also know that firsthand too. There's an increasing body of evidence that's coming out that actually these technologies can not only solve problems, but they can create them too. And that's something that is quite concerning for the health service. There's lots of different ways that bias and harm can come from AI technologies in healthcare. And this is a really beautiful paper that kind of sets out all of the different ways that bias can creep into these algorithms from the moment that you select the problem that you're thinking about to the end of the process where you're actually implementing it into the healthcare system. But our project really is looking at points number 2, so data collection, and point number 4, algorithm development, to try and encourage people to consider equality and diversity principles within their AI algorithm development. So the project was an enormous international effort. We involved 350 different people from across 58 different countries, which was a really mean feat, but we're really proud of the reach that we managed to get. And actually that then led to the production of recommendations that are about dataset composition, dataset transparency, but also dataset use. So what decisions are being made during the development of these AI technologies. And the project was split into 3 parts. It started off with some reviews of the existing literature to come up with draft recommendations. We did systematic reviews of existing data sets to see what the kind of current landscape looked like. And then we also interviewed people that this was relevant to ask them about what the facilitators and barriers might be to the use of these sorts of recommendations. But what I really want to focus on is the PPIE element. It was a strategy where we ingrained the patient and public voice within all parts of our project, from the moment that we wrote the grant to actually thinking about how we can disseminate this work. And that's what I'm going to go into a bit more depth about. But if you really want to find any more about the project, then you can look at our website, datadiversity.org. So how did we involve patients and the public as part of this project? Well, as I said, they were really part of the work from the offset. We had several committee members. So within our working group, we had members of patients and the public who were part of that. We also arranged regular meetings with a wider committee. And then we also I found quite a novel part of the project, which was our international engagement effort. And that wasn't something that we'd ever done before or we'd ever heard anyone else do before. But actually we thought that, that given that this is an international project, we hope that it has international applicability. Well, actually, we need to be thinking about the patient and public voice on an international level. And that was a really interesting experience that came with its own challenges. Things like differing time zones. How do you coordinate meetings with people from different places? What about language barriers? How can we include people with different language needs? And the way that we landed with that was using an online platform called Slack, which you might use within your work, to do kind of asynchronous chats where people could actually respond at any time of the day. So how did we get our PPIE members on board? Well, we had a really big network of different organisations that we found. We approached organisations like Black in AI, Women in AI, but also we wanted to make sure that we were including people that didn't have any background knowledge of AI. So we also used the network set up by the NIHR and also social media push as well, using our contacts online too. And that allowed us to achieve a really diverse set of individuals within our group, and that really was important to us. We actually made that a criteria from the offset, that we wanted to make sure that we had representation from lots of different demographic groups within the work, because obviously it was relevant to our project being about diversity and inclusivity. And so we actually did almost like an application process where people had to describe their experiences in life, and we incorporated that within our recruitment strategy, which I think actually was really beneficial because we were able to consider the person as a whole. Thinking about the actual PPIE strategy, because I think this is something that can be quite daunting, and especially with projects like this, where I think the PPIE concept probably came from the clinical trials space, where you have a particular disease and you're involving people with lived experience of that disease. But actually with a project like this, which feels a little bit more broad than that, it can feel quite daunting, I think, to understand how on earth to tackle this. How on earth where do you start? Who do you include? So hopefully this kind of strategy gives an idea of some of the ways that you can actually incorporate this sort of work into your projects. So we started off with initial onboarding, and that's something that I'll discuss in a slide in a bit. But that included us giving some background information about artificial intelligence in general, and about some of the challenges that we know to exist within that field. We then went on to explore some of the key concepts relating to the project, and those were things like what do people understand about race and ethnicity, because these were concepts that we were going to be covering within our recommendations, but we knew there were varied opinions about what that meant in different contexts. So we felt that was a really relevant thing to be discussing with our members. We encouraged their direct input on the standards that we produced, which was really interesting because they really provided an alternative viewpoint for the recommendations that we had. But we wanted to also make sure that we had a real open door policy for advice and support, because we were very aware this is quite a complex subject, and we wanted to make sure that people didn't feel embarrassed or awkward about the fact they might not understand something, because actually these are difficult things to get your head around. And so we wanted to provide that support outside of the meetings, where people could confidently get in touch and ask questions and clarify certain things that were discussed. So I think that was a really powerful part of the strategy that actually was utilised quite a lot by the members. We made sure to put accessibility measures in place, because we had a few members with different health needs. So we provided paper alternatives to the online content that we provided. And also we made sure that all of the software that we were using was compatible with whatever disability software they were using. So I think it's definitely worth keeping that in mind, that actually sometimes you can be excluding people because of your strategy isn't aligned with what they're able to engage with. We fed back to our members about what their contributions had been and how they'd helped us along the project, and I think that was really well received by the group, because it showed it was a full circle really, that actually they were contributing and there was a direct change because of it. And just to mention as well, we did reimburse these participants for all their time. So whether that was time actually within the meetings or time before with the pre-reading or after reading documents, we made sure to provide them with timesheets to actually let us know how long they'd been spending on these things and reimbursing them appropriately. And I think it's worth mentioning that actually, that can be more costly than it seems up front. And so if you are costing these things into grants, just being really honest about how much time these things do take and how much money is going to be needed for that sort of activity and to do it well. So this is a little bit of a controversial slide here regarding onboarding, because there are some schools of thought that actually if you're teaching people and you're providing information to these participants before they engage in your project, are you somehow bringing them along into your worldview and away from the worldview that they initially had? And I think that's a really interesting pushback, and one that I'm not sure I've totally landed on myself. But I do feel like there were some participants within our group that actually fundamentally would not have felt confident enough to speak within our meetings had we not done that onboarding with them. And so I think that's a real reason to do it, because actually we want to make sure that we're providing an environment that everyone feels like they can contribute. And if they're embarrassed about their knowledge or their baseline or their views, then that's going to fundamentally impact the way that they engage in that meeting. So I think for that reason, it was really beneficial to have done that kind of onboarding, especially in a subject like artificial intelligence, which is really difficult to get your head around. And there's also a lot of miscommunication and misinformation online that people are exposed to on a daily basis. So there was actually some unraveling of perceptions, then rebuilding perceptions that we needed to do in order to do this well. But some of the subjects that we covered initially were things like what is AI, what is health data, what are some of the challenges, and actually where does this project fit in. So we had quarterly committee meetings. We set the agenda in advance. We had ideas about what we wanted to achieve from these activities. But actually, we were also very aware that often with PPI activity, it's not necessarily hard outcomes you're looking for. It's actually more about the process, about how those conversations impact your perception as a researcher. So it's perhaps a little bit harder to pin down exactly what the outcomes are, but I think I would encourage people to get away from worrying about that too much and just being confident that it's still worthwhile, even if you can't find a real tangible thing to report. We used Google slide decks so that people could see content on the Zoom meetings, but we also used some interactive portions of our meetings too. Jamboards we found were really helpful because it allowed people to semi-anonymously write comments and contribute, which I think for some thorny subjects that can be quite useful. We recorded all of the meetings, but we made sure to make it clear that wasn't that we were going to be sharing it anywhere. That was just for our purposes to actually be able to make effective notes that we could then refer back to. And then we made sure to circulate those minutes that we actually got from those recordings after the meetings ended, so people could refer back to them themselves. This is just an example of one of the feedback to participant sessions that we did. And I think this was actually one of the most powerful things we did during the process. And we called it You Said, We Did. So we had along the way different examples of things we'd pulled out of those meetings and how the things that our participants had said had impacted our project. And we were able to directly show that to them on the screen. And I think that was a really worthwhile thing to have done because it not only provided them with reassurance that their work was being listened to and implemented, but it also made us reflect and think about what impact they were having on us too. So that was a really nice a nice activity that I would really encourage people do. So thinking about our international perspectives, as I said, it was quite a challenge to do this, and I'm not sure we did this completely well, but it was kind of the best way that we could think of at the time. So we ran these Slack channels that we then, as you can see on the screen, we put forward different questions that we were then encouraging our participants to respond to. We did host a couple of online webinars as well at different times of the day, so that we made sure to do it at times where all the time zones in the world could be attending at some point. And we ran those as drop-in sessions. So we didn't say to people they had to be there from start to finish. This was more about us being available as researchers, also providing a face to ourselves, because we were also really conscious that by doing this totally online with no meetings, we could probably just seem like we were some bot somewhere, and that probably wasn't going to help their interaction with us. So we did make sure to prove that we were real people, and hopefully they got something out of those meetings too. So reflecting on our experiences, there were lots and lots of challenges to this, and I really don't feel like I'm a world expert, even having gone through that whole process for a few years. And there's definitely a lot we could have improved on and a lot to learn as well. I think some of the main take-homes that I would think about is with regards to the onboarding, is it needed in your context? Is it going to impact the outcomes that you get and the kind of engagement that you get with people? Or is it actually necessary to open that door for people to contribute meaningfully? I think it's really interesting to think about what the function of the PPIE group is. This isn't market research. This isn't getting the perceptions of hundreds of thousands of people to come to an absolute conclusion on something. This is more about making sure that your research is grounded with the views of the patients and the public. And actually, as I said before, it's not necessarily about achieving hard outcomes. It's about thinking about how it's impacting your perceptions and impacting the process of completing your research. Resourcing is a really important thing, so thinking about that up front. Also being aware that, you know, being inclusive and making things accessible can be resource intensive, so just be upfront with that. Make sure that you're thinking of inclusivity from the offset, because what you don't want to be doing is creating a strategy, like not putting enough funds towards it and then not being able to do it justice. And then thinking about how we effectively reimburse people. And it might not just be about payments and expenses, because there's lots of complexities around that in different scenarios. But actually, authorship can be a really good way of you know, showing gratitude and input as well. So you can be creative with the reimbursement as well as payment. And I think one thing that I particularly found hard was building and maintaining momentum through the project, making sure that you're always thinking ahead. You've got a meeting coming up in 2 months' time. It's worth thinking about what you're going to talk about right now, because the last thing you want to do is get to 5 minutes before the meeting starts and not have something that you want to get out of that meeting, because it's such an incredible resource, and to not put that planning in place can kind of undermine you a bit. So being really prepared, I think, is really useful. If you'd like to join our conversation, I co-lead an online community with one of my colleagues, Joe, and Ellen's also involved as well. And this is Data Science for Health Equity, which is, you can join via Slack, or you can sign up to our newsletter. And we host regular events where we discuss some of the subjects that I've brought up in my talk today. It's a very chilled kind of environment, and no questions a bad question. So we'd really encourage as many of you to come along to that, to join the conversation and try and tackle some of the challenges that we might face with participatory research methods. So that's all from me. I think we've got a panel now, and thank you for listening.
Thanks so much. Eleanor, if you'd like to take a seat over there, and we're going to also bring up Hannah, Evelina and Linda. And just to continue our chilled, I think they're called fireside chats now. Like when did that become a thing? So yes, we're going to have a nice conversation. And also, if anyone wants to add some of their questions to Slido, you're more than welcome. Or I'm sure if you put your hand up, someone will run around with a mic too. So I'm hoping we're all mic'd up properly. So first of all, let's do some introductions. So my name is Ellen Coughlan. I work at the Health Foundation as an Improvement Fellow. And at the Health Foundation, as part of our new strategy, one of the kind of cross-cutting priorities is public participation. And we've been doing a lot more of that because we're really trying to challenge ourselves to embed different views and perspectives into our work, because as an organisation that's trying to improve the health of the UK, obviously we need lots of different diverse perspectives to help do that. So Hannah, who works in our data analytics team, can shed some light onto how we as analysts are doing that, because I think often as analysts you kind of perhaps feel 2 steps removed from the actual kind of service delivery, perhaps. I don't know, that's kind of how I think I was feeling when we were launching that work. But yeah, really pleased to be chatting to you today. You've already introduced yourself. Everyone knows who you are. Okay, Hannah, do you want to introduce yourself?
Hi, I think, is this working? Yeah. As Ellen mentioned, I work with her. I think we both joined the Health Foundation at about the same time. 5 years ago, I joined as an analyst, and it was around the time that we were just beginning to think about developing like a framework for involving patients and the public in our analytical research. And over the years, we've sort of evolved that framework. I think we've now done about 30 projects involving around 100 people. And I'm now managing a program called the Network Data Lab, which is a collaborative network of analysts working in 5 parts of the country, and patient and public involvement and engagement is really sort of embedded throughout the life cycle of this program. So I'd be happy to talk to any of that today.
Thank you. And we have Evelina and Linda, who were both participants of projects that the Health Foundation co-funded with NHS England. That was our AI and Racial and Ethnic Inequalities programme. And so I will hand over to Evelina first to introduce yourself and talk a little bit about that project.
Thank you. My name is Evelina. I'm head of HR and talent acquisition for the EdTech. So I advise different EdTech startups. The research was amazing because I got to share my experience from the tech perspective. I was amazed at how technology is intertwined into different sectors. So throughout my work, I obviously communicate with people. So reaching out to wider audiences is part of my job as well. I integrated learning management systems, HR systems in my daily work and some different digital platforms. And generally we work with digital platforms in EdTech community. So the research was very also eye-opening. And I had this feeling of being able to contribute to something meaningful. Obviously, we're reimbursed, etc. But looking how my feedback directly influences the product that is being built, that will later impact the lives of so many people, and the product was generally so useful. This is it in short.
Thank you so much. It's such a pleasure to have you. And Linda.
Can you hear me? Yes. Hi, I'm Linda. I'm an Essex girl. Sorry, I'll say formerly known as an Essex girl, but I'm now an East Londoner. So I'm going to talk posh to you now. Okay, so I volunteered because I saw a little ad on X, formerly known as Twitter, and it was just a little ad saying volunteers wanted, and I thought, shall I? So I thought, okay, do you know what? I can do that, and from then on, it rolled into it's because I met Evelina from there, and it rolled into a really good project, because when I don't know about everyone else, but my first thought process on AI is, because every time you key something into AI, it never gives you the answer that you actually want. Okay, it says, please select from these, and then nothing that you actually want or nothing that you're actually interested into, and then it goes all the way back again. So I was quite apprehensive when I actually started with the AI, ChatGPT, and then being a part of this group, they were actually able to stare it for the fault where I suddenly thought, actually, there actually is a need for that product. And also it did change my mind. But then I have to think about the community. So obviously I am an Essex girl, but I am black, if you didn't realise. If you actually close your eyes, I could be anybody. But as I say, it's good to have, if you are going to have a PPIE, to have people from all different pockets of the community, so that, like, let's say to try and get Afro-Caribbean men and African men involvement in certain things, it's really quite difficult, because first thing you'll get is, I don't need that, and things like that. So it is really, really good to get a full-rounded approach, and then you have a lot of equality in the answers and perspectives that you're going to get. And also what we did find is that the people, Tom and Nikki that were carrying out the research, I found myself trusting them. So I think trust is the main thing. So from our panel, we had to trust Tom and Nikki, and it was, we trust them with the information that we're given. And also, nothing's wrong. There is no wrong answer. It's just your opinion on how something is getting done. So, as I say, it was really good, and I feel quite proud that we were a part of it. And so I think that's enough about me.
So I suppose what I was going to ask, which segues quite nicely from the kind of concept of trust that you were just discussing, is like what makes good PPI, or what makes good participatory research. And as I was listening to you talk about co-production, I was reflecting that as a funder, sometimes the things that you really think that you want rub up maybe against the traditional funding models, because it can feel a bit radical for me to say, do you know what, I'm going to give you, say, £100,000 to do a project, but we haven't actually decided what you're going to deliver, or what the outputs are going to be, or how you're going to deliver that. And that's actually really what co-production should be. You shouldn't be coming into the room talking at people about what you think they need to deliver. So I guess from my perspective as a funder, it's like an interesting tension against, it feels, quite radical against how we would do traditional funding approaches. But I think probably we need to sit with that discomfort and try and find different ways to, also kind of engender trust, to make sure that just because a project doesn't go, in the way that you had envisaged when the application was written, doesn't mean that it's not going to still produce something great. Now, that's more of a ramble than a question, but I guess a question to you, Hannah. What does sort of effective PPI look like for you?
So I think it can look like a lot of different things, and I think it's on the research team to really think about, like, what are the questions we're trying to answer. You're not trying to tick a box through doing these sorts of activities. You will first want to think, okay, what do we already know? And then use that as your starting point to think about whose perspectives are we missing? Who do we need to approach? What questions do we need to ask them? I think there is a tension here, because I think some involvement is always better than no involvement, pretty much. But on the other hand, the earlier you can involve in your research cycle, the better. So I suppose I've been involved in quite light touch PPIE that's come sort of near the end once the analysis has been done, and it's more about helping us to interpret findings. That's been really valuable. And sometimes, you've got to consider the constraints in which you're working and the resources and the capacity that you have. And sometimes that's all you have the ability to do for a project. But I suppose the most effective, and where there's like most scope for PPI to really influence you and to draw on the real benefits and allowing a bit more flexibility, is when you can involve much earlier in the research cycle. So even when you're selecting your topic or thinking about them, what the specific questions are that you want to answer. I don't know, what would you say, Ellen? You've been involved in quite a number of projects over the last few years as well.
One thing I think that maybe it's, having listened, actually, we had an away day a while ago at the Health Foundation, and we were chatting. We had a presentation from a project called Common Ambition in Brighton and Hove, and they were doing a piece of work with people experiencing homelessness, and it was really important for them to have a safe space to discuss often quite emotive topics, and whether that means going to the same place every week at the same time, having the same people like the researchers to engage with, and keeping a sort of a consistency and a predictability about it. The project that Linda and Evelina were involved with, which was around sexual health, also can bring up quite difficult discussions that you kind of have to feel like you're in a trusting space. And so would really suggest anyone interested in what a sort of trauma-focused approach, which is the language that Common Ambition used to describe that way of participatory research, look up Common Ambition, Brighton and Hove, because I think they did a really fantastic job. And it's something that I think, we heard Anita earlier speak about people living, years with like many illnesses, chronic pain, anxiety, depression. These are all things that we're going to ideally be understanding better with data, analysing better, and kind of driving improvements in. That means that you have to involve people with that lived experience, and that can be difficult for those people. So that's, I think, what was kind of swimming around in my head. How about you, Evelina and Linda?
I totally agree about building trust because there are quite a few ethical issues we need to address, like data privacy. Where is my feedback going to be used? Especially, bearing in mind, like you mentioned, it was about sexual health. Where will it fit into? Will my name be mentioned, etc. So we did feel like it was a safe environment because we were reassured quite a few times that our names will not be mentioned, and no one will ever figure out who contributed to this research and what specifically they mentioned, unless we wanted it to. So this is one of the key issues, and also another one is, I'd say, involving patients and public from the very beginning, so they could help shape the questions, the methods. And like you mentioned also, it's co-producing the work, so it's crucial that they are there from the very start of the project.
So for me, I would say the W's. So what's it for? We want to find out what it's for. Who's going to use this information? Where's this information going to go? How's this information going to, and when? So, there has to be a time limit, because otherwise, you could be going on a research, you can be going on a PPIE for about 2 years, and then you lose momentum of the panel because they're only just doing it for the reimbursement. But then there needs to be some sort of thing, some sort of goal. So I think that will probably make more of an effective PPIE. So just stick to the W's: who, what, when, why, and how.
I love that. We'll make a sticker for next year. So perhaps thinking about, as people who have been undertaking PPIE, like, is there anything that you have, like, personally, professionally got out of learning how to do that? Eleanor, do you want to go first?
Yeah, well, I'm just going to be really honest. I hadn't even heard of PPIE when I started, and I think that's something I'm really aware of. That you come to these sorts of events, and people mention it, but don't necessarily go back to basics and talk about where it's come from and why it's important and what you can get out of it. So I think that's probably my biggest learning curve, was that I really now am like the biggest advocate ever for it, and can really see its value. And I know I mentioned it about 50 times in the talk, but really thinking about how it's not necessarily about that tangible goal. And I think that point that Ellen made about the priorities of the funders is that you can prove the worth of whatever you're doing, and I think we need to be creative about how we actually show that, whether it's through the "you said we did." That can be a really useful way to show the funders like what the power of that particular part of the work was.
Yeah, I'd echo that. I mean, I was also in your boat sort of 5-6 years ago of never having done any PPIE and really starting from zero. And I think as a whole team, as Ellen said, we were in that situation. So just one of the first things we did was hold a session with everyone, right, including the senior leadership within our team, about our hopes and fears around PPIE. And that just really helped to get those things sort of surfaced about like what were some of our worries so that we could address them, and what were some of our hopes so that we could really focus on achieving them. And I think as a team we've gained so much in confidence, and starting small with just individual interviews with patients and members of the public, and then building up into more complex programs which have PPIE kind of threaded throughout them. And now there's, as analysts, I think it's a really a skill that's growing in importance. It's a transferable skill. It's sort of very increasingly important to funders, but also data controllers. We're being asked to justify when making applications for data sets or data linkages, sort of explain how we've involved patients and the public and what the public benefit is and how we can kind of demonstrate what the public benefit is. So there's quite a number of sort of, reasons for doing that. And I think in terms of the projects I've worked on, sort of, I can think of so many examples where I've come in with my own assumptions about how, for example, like a particular healthcare pathway works. And I'm applying that understanding of the healthcare pathway when I'm looking at my results. And then you speak to somebody who's got lived experience of that pathway, and it's like, oh, no, like there's on paper what it looks like, and then there's the reality of what that pathway can look like, and then there's variations in people's experience of that. So just having that lived experience as a basis for testing your assumptions, for understanding sort of, what data issues are out there that might prevent you from interpreting your data in the right way. It's just time and again been something that I think every exercise I've done has shed some new light in one way or another.
Yeah. So along that sort of data theme, we've had a question around healthcare analysts are increasingly using data to understand need and opportunity for prevention, but it risks exacerbating inequalities. What can analysts working on biased data sets do to integrate co-production into their work? Maybe Eleanor, I'll come to you first because you've done a whole load of work on using biased data sets.
I would just say take a look at the Standing Together website. But that's kind of the basis of our whole project, was how we can help people think about equality and diversity issues within their use of health data. And so, this project was built from the AI space, but I really do think it's relevant to lots and lots of different spaces. Actually, anyone that's using any sort of data at all, I think, could get something from these recommendations. So I think that's a really good place to start. And then I think there's something to be said for using inspiration from other people's projects. So we are publishing a paper a little bit about the work that we've done with PPIE, but as part of Data Science for Health Equity, we're really looking to make some sort of resource for people to actually refer to think about how they can do meaningful PPIE as well. So Data Science for Health Equity and the Standing Together website are definitely two places that you can get inspiration.
And for those of us here in person, you can find some Data Science for Health Equity laptop stickers downstairs in the room with the stands. Any kind of extra thoughts about how analysts can employ co-production methods to sort of address some of those issues of bias?
I suppose I've got a specific example that springs to mind from some work that we did on children and young people's mental health, and in speaking to our panel of people with lived experience. They had particular questions for us about underrepresented groups, one of which was the LGBT plus community, and they wanted to know whether we could do more analysis around the experiences of these people. And we couldn't with the data that we'd got, and we could have just sort of said, well, it's not going to be possible. But I think as analysts, there is an onus on us to then feed that back, and to, even if it's not possible within the scope of your current project, to think what we can do to influence the creation of better data sets in future. In this example, then there was a spin-off kind of project created locally to collect additional data. That's harder when a lot of the data sets we work with at the Health Foundation are well-established national data sets, but I think we do see it as a big part of our role to be kind of trying to influence data strategies at a national level, and there's perhaps more that can be done at a local level.
And thinking about actually those groups that we're talking about who experience the kind of brunt of those biased data sets, Linda, you said that you saw the advert on X. Evelina, where did you find out about that opportunity? And I guess a question for everyone is, how do we find people with the highest access needs, so people that don't speak English, people, who really are not really served properly by the system at the moment?
Do you want my honest answer?
Yes, please.
I saw the QR code in the bathroom in my university. So I just scanned it. Well, as I mentioned, I'm obsessed with technology, so the QR code was one of the unique selling points. But also, I think it briefly mentioned that they are looking for underrepresented groups for their research, and that they will be giving away vouchers if you are chosen. So yeah, being in the university, I was like, why not try? And then it turned out to be such an interesting research. So I think they did a great job that they advertised on different platforms, because we obviously need to use social media for that. And like Linda mentioned, she found it on X, and the target was to reach out to as wide groups as possible, because it was on sexual health. So the group had to be as big as possible, and we can see that they use different channels to do that, which I think is great.
Any other thoughts from the rest of the panel on how to kind of reach groups that aren't traditionally engaged with particularly well?
I suppose it would depend on the actual project itself. So you just have to think. Sometimes you have to think out of the box. Sometimes you think of, we can do everything with regards to technology, but then we're ostracising all the people that don't use technology. So like you had the scan code, I had Twitter. So we have to think of community centres, doing a few little posters, maybe leaflets, the old-fashioned stuff that we used to do. And they're the people that we need to target, not the ones that are actually on social media. We need to target, we need to go back to go forward. So, because there's lots of different communities, talking about going to places of faith, places of worship, just to try and get everyone out, so people aware that these PPIEs are happening.
If I can just add to that, I mentioned that I work in tech, but I also worked in hospitality, for example, and this is exactly how Linda is describing it. We need to go back to go forward, and not everyone was able to use technology, even connecting, using the link to a Google Meet, or even sending their CV online. So people would very often just pop into the restaurant and bring their paper CV. So we definitely need to, reach out to those groups that are not very user-friendly with the technology. Talking about hospitality, I'm talking about someone my age or even younger. So we shouldn't assume, there shouldn't be this bias that everyone from Gen Z or millennials are so fluent with technology. They are not. So we need to look at charities, at universities, and at other groups, community groups, that could lead us to those wider audiences.
Yeah.
I think another thing to be said is that as research groups we can share. So we found that our project's wrapping up now, but our group are just so enthusiastic and really keen to get involved in projects in the future. And actually, it's not about us kind of saving them for ourselves and you're not allowed to use our PPIE members. Actually, we've made an effort to promote them as a resource. We've done the work, we've done the groundwork to explain what AI is, and actually they should and can be used by other groups across the country too. So yeah, I think sharing's good.
Can I say one thing too? I think there's a phrase that's I think I'm hearing less of now, which is a good thing, which is like hard to reach, and which sort of almost puts the blame on the people who are harder to reach by virtue of their particular characteristics. So we're trying to sort of flip that and replace that with the term seldom heard, which puts the onus much more on us as researchers to go out and meet these people where it's convenient for them. I think particularly given the point, Ellen, you were making about lots of the participants we might be trying to reach might have chronic conditions, or they might be caring for people who have chronic conditions, which means their time is under much more pressure. So really kind of, don't expect them to come to you. Try and find out where they are anyway, as you were saying, Linda, and like community groups, third sector organisations, existing research groups, but also trying to always evaluate at the end of a project and think about, like we're always thinking about what we can do to address the various ways in which our panels are not diverse, and expand them depending on like the particular direction of your next project.
Yep, and a thought has just been sparked off actually, because the person who answered that question specifically also referred to people with no fixed abode. And I guess when you set out with a set of, like, with an idea of what you want to do, you might think, oh, well, we can give a payment of £40, £50 to people that engage with us. But if you're issuing payments by like a bank transfer, then that can really mess up people's benefits payments. And so even just really thinking through with people how to provide them with like something that's useful to them and it isn't going to create way more burden for them is like super important. And it's just not something that I would have thought of, because I live in like a specific, like, I don't know, frame of mind. And so, listening to other people's experiences of running PPA projects and working with different groups has just really taught me that there are a lot of different ways in which you can remunerate, I guess, reward people. You spoke about doing co-authorship. Is that something that you've done? And Hannah and the rest of the panel, is that something that you've experienced? What other kind of opportunities have you kind of had from doing this kind of work, except from just, I guess, cash?
So I think in the future, I think what would be really good if there is a choice. So someone, let's say with me, because I work, if I was to get any extra money, Mr. Taxman would be knocking on my door. All right, but then if it's in vouchers, then obviously it's not something. Well, probably Mr. Taxman probably still will have to knock on my door, but I can just say I've got it in vouchers. So, so there are different things. So I think that might be something that you would have to explain and be a bit open with regards of payment, because some people will just say, actually, I'd rather vouchers.
Yeah.
And then if we've got people that are homeless, and then maybe you can just give them the vouchers themselves, because you have to be very, very careful, because if someone's homeless and then you're giving somebody money, let's say if they've got an addiction or anything like that, you have to be very, very mindful. So I would be very, very cautious about, because obviously they may be getting benefits, and if that tips them over the benefits, then that will create an issue.
Yeah.
So I think always speak to people and find out. No, it would be nice if they could actually have a bit of a choice. Say, actually, I fancy some Amazon vouchers or something like that.
Yeah, I would agree with that. So we were rewarded with vouchers. I was very happy about it. I think it depends on different groups, just like Linda mentioned, and it's very important to gather other people's feedback. What would be the most important for them? If someone is working on their, let's say, personal brand, or they're going to be doing a PhD, maybe co-authorship, or their name mentioned somewhere, this exposure and visibility would be more important for them. Even the ability to post something on LinkedIn to show that you're an expert, this can be more important to people than, for example, vouchers. Generally, after COVID, this flexibility of choice, even where we work and how we work, but also how we contribute and how we do research is very important.
Yeah, we always try to offer a choice, I think, between a payment, vouchers, or a charitable donation. Sometimes if people are sort of participating on behalf of a community group that they represent, they might like a payment actually to go towards a charity of choice. But in terms of, acknowledgement, I think it does need careful handling and getting explicit permissions, like to name people, for for example, very much allowing that personal choice, as you said, and if there are things that people are going to help them in their kind of own career, then trying to find opportunities to do so, 100%. Yeah, in terms of remuneration, I think you covered sort of that this should always not just include the meeting time itself, but preparatory work, and timesheets are a great way to make sure that you're allowing for sort of variation in how much time somebody might need to prepare for an upcoming meeting, and then obviously if there's travel included, then those sorts of expenses, and then also thinking about caring expense if somebody needs childcare or care in place for the person that they're looking after. We include that as well. But there's very helpful guidance out there from the NIHR, among others.
I was about to say, NIHR have a recommended, like, this is what you should be remunerating for a day, cash-wise, this is what you should be remunerating for half a day. Any other thoughts on that? No. One question that's come through, which relates to something that you just said, Hannah, about someone, for example, coming in to represent the views of like a community. I guess how do we manage the fact that groups aren't necessarily homogenous, and someone might want to come to represent the views of community, but then they cannot represent the view of every person in that community. So how do we manage that? How do we approach that in a way that feels sort of inclusive but mindful?
So yeah, that's really hard, and I think it comes back to this question of how inclusive is inclusive, and how many representatives of each group do you need, and how many intersections do you need. It's impossible to actually have a group that is totally representative of everyone you could ever want, and so I think we need to get away from worrying about that too much. I think having diversity and inclusivity at the front of your mind is really important, but actually if you've got a community representative, you can do things to try and disseminate your work and also gather their views back. So we had a representative in our group who was a community leader, and she was incredible at sharing our work. So we had a big survey that went out online, and she printed out copies and shared it with her community network. So we got their feedback through that. So there are lots of like creative ways that you can be including people's networks without actually having them in your PPIE group. And perhaps it's just worth thinking about those.
Any thoughts from Linda or Evelina?
I would agree that we need to maybe remove this perfectionism to a certain extent, because how much is enough, and how many members of the community do we need to include? How representative will it be? We can go on forever, and just at some point we need to be satisfied with how many people we got. Obviously, we need to sort of strive for the better and for the best, but at some point we just need to draw a line that, yeah, this is enough, and this is what we're going to be working with.
I suppose it depends on the project, it depends on what is your aim on your project. Who not saying you don't. It's really hard. I don't like the word target, but we do end up targeting, no matter what we say. And so let's say you're going to do one about sickle cell. That probably won't be as wide or as vast. So because obviously it's something that doesn't affect everybody. So as I say, it will have to depend on your actual project, and then who's your target audience. So yeah.
Thank you. I wonder as well, we've been speaking about PPIE at a sort of like micro level, but we have also touched on information governance, and I suppose that relates more broadly to trust and confidence in like how people's data are being used, not just like in the remit of a research project, but I guess more broadly. And obviously there are different groups in different communities that will have kind of historic distrust for like institutions. And so I suppose, how much is it important that each of us are trying to build up that trust and confidence, and don't know, what's the role of us as researchers, us as funders, you know, people who are already involved in that kind of work? Like, how do we try and build that momentum of, I guess, transparency and openness about how data is used?
I'd say we need to start with communication, so clear, transparent, direct communication, showing where this data will be used, how it will be used, but also showing examples from the past, looking, you know, retrospectively at, you know, how it was used, and, you know, showcasing the best examples to reassure people, because it will also give them the sense that, you know, it was already done, so, you know, it's there. It's not something totally new, and this will give them confidence that this time will also, you know, my data will also be handled sensitively.
So for me, I'd say everything has to be outlaid right at the beginning. So on your first appearance, and when they first meet you, this is who I am, this is what I do, this is what the project's going to be, and it will have to be something that it would have to be information right on the first day. So, you know, as a panel, we know how our information's going to be used, who's going to have access to it, everything else, right from the get-go, so that it doesn't bite us in the bum later on when we find that, you know, the information's been shared and we didn't want certain parts to be shared. So yeah, right from the beginning, and then that installs a trust in whoever's running the project.
Yeah, and actually, I can't remember who I was listening to speaking last week, but they were saying sometimes things just will go wrong, but actually being transparent and holding your hands up right at the beginning and saying, I'm sorry, this is what we're doing to write it, is really important. But I guess, Eleanor, it also just comes back to what you were saying about closing the loop and just making sure that people understand what's being done and kind of actually get a sense of the benefits of the work that's happening with people's data.
And I think as well, like, it's quite a lot about the culture that you as the research team create with that group. And I think historically it could have been quite us and them focused, but actually this idea that you're all part of the same team actually then encourages a bit more of a trusting environment, and an environment where people can just speak out if they feel like things aren't going quite right. Having that kind of, as I said, the open door policy, having a phone number available that if people, you know, things spring to mind at a random time, not in the meeting, that they feel like they can contact you to discuss it. That I think is really powerful and helps with that kind of trusting environment.
Yeah, and I think sort of going in to these activities with your eyes open as a research team, that things will come up and suggestions will be made that are probably beyond the scope of what you either set out to do or what you might be able to do within the boundaries of your project, but not brushing those things under the carpet. But yeah, as you say, being like honest and open, that and using, I mean, I love the you said we did framework for feeding back. So it's almost like a third section. You said we did, this is what we couldn't do, but this is what, like, can we find any vehicles to make sure that those great ideas that you had don't just sit on a shelf here as things we couldn't do, but you know, either in our reports published, you know, these are things which we would have loved to do but couldn't do for X, Y, Z reason, or can we find other groups that might be able to take forward some of those as particular projects? So always trying to find like a home for ideas that you couldn't take forward.
On a slightly more practical note, actually no, that was really practical. I guess I'm thinking about the workflow that we created at the Health Foundation, but there's something that I love about the it's like a proper resource. Someone's asked whether we have any tips for using, like, engaging stakeholders in the analysis process. And I was just thinking, we've shared that on GitHub, but maybe do you want to speak a little bit about what that represents and how people could use it?
Yeah, sure. So if you Google Health Foundation PPIE Guide to Action, I think it will still come up. We posted on GitHub a resource or a series of resources known collectively as a guide to action, but there's a one-pager, which is that what you're
Yes.
thinking of Ellen,
Yeah.
like a decision tree, which has like 20 different ways in which you might want to involve patients and members of the public in an analytical project. But depending on, I mean, it leads you through a series of questions of what are you looking to do, how much time do you have, what resources do you have to draw on. It will give you a series of options, and then there's an accompanying guide which has for each of the 20 options, sort of 3 or 4 pages on how you would actually go about designing and running that type of activity with checklists and sort of ethical considerations and the kind of pros and cons of each approach, and then it will help you to narrow down. We found that to be very helpful.
I love it.
Getting started.
Yeah, it's such a good piece of kit that we have. And it also means when you're feeling, read me, slightly time pressured or sort of like, oh no, I really just don't have enough time for that, then you are just reminded that, no, if you don't have much time and you don't have much resource, this is what you can do. We've just got a few minutes left, so I wonder if each of us, if there's like a sort of message that you want to send to researchers or to funders or to people who you think should be getting involved in this kind of work, what's like your message? What's your call to action?
I think mine is to not underestimate how much resource this kind of work can take. If you want to do it well, make sure that you're resourcing it well.
I was going to say the same thing, but let me quickly think of something else. It's sort of related to making sure you've got enough resource to do it well, but I think building buy-in with senior leaders and other wider teams in the space you're working in, and getting them to recognise the value that PPI brings, which in turn means that as you're doing your PPI, you need to be sort of evaluating and collecting examples of impact in order to then sort of make the case for further investments. That's been a bit of a journey that we've been on, I think, over the last few years.
Great, thank you. Evelina?
Mine would be just keep going. I think it's so easy to lose motivation in any project, to be honest, especially if it lasts for, I'd say, over a month. You start being so, motivated, interested, but then you obviously come across some obstacles, so people not willing to contribute, and you have to just keep persuading them, explaining, educating. So I just say, keep going and just maybe remember yourself at the very start of your project. Remember what your purpose is, why you started this in the first place, and make sure this idea just leads you through the whole project.
Thank you. And Linda?
I just say have the right person do the right job, because just because you've been given a project doesn't necessarily mean that you can run a panel. So you've got to have that personality to engage people that you don't know. So I would say be very, very mindful on what your communication skills are, because if you haven't got communication skills, you haven't got a project, you haven't got a panel. So, yeah.
Thank you so much for your communication skills, and thank you for joining us today. Really, really enjoyed that.